Welcome to the Introductory Kinesiology online lecture for the shoulder complex, which includes the shoulder girdle and the shoulder joint. We'll start with the shoulder girdle because that's where we have proximal attachment to the axial skeleton, that being the sternum. Top of the sternum is called the manubrium, and that's where we attach the two clavicle bones or collarbones. They're going to form the front of the girdle and end up at the main bone. We'll be talking about the scapula. Before we get into the anatomical structure, I'll show you the motions possible, and these will lead to the shoulder joint motions that we'll be looking at for the second half of the lecture. So for the shoulder girdle, what we can do is elevate, shrug our shoulders up, depress, pull them back down, protract, just pulling them forward like you're giving yourself a big hug, retract, or pulling your shoulder blades together, and then there's rotation that they can do, upward rotation or downward rotation, which have to happen when I move the arm, so those will be part of that. Finally, there's a tilt that you can do to your scapula. If I bend back like this, you might see it poking out a little, but that's not a natural motion that we'll investigate. So we're going to be looking at elevation, depression, protraction, retraction. So if I show you the scapula, which is where we'll be spending all of our time, and there's a diagram on your test for this. I have one here on the image, and I'll start with this one. The scapula, the one that I show you on the test and the one that's in these images, will be a right scapula with a posterior view. We have a top and a bottom of it. So these are called the superior angle and the inferior angle. We have borders. This border will always go to the axilla or underarm. So it's known as the axillary border or the lateral border, you could say. That makes this one the medial border, but its other name is the vertebral border because it's up against the vertebrae. This piece is called the spine, and you can palpate that along your back. And the top of it, called the acromion, is a little roof that would be right here on your own shoulder. Above and below the spine, we have fossas. So this is called the supraspinous fossa and the infraspinous fossa. And then here, where the head of the humerus meets the body of the scapula, we call this the glenoid fossa. And then coming off the front, right here, there's a process called the coracoid process. So coracoid, acromion, spine, supraspinous fossa, infraspinous fossa, glenoid fossa, medial border, lateral border, superior angle, inferior angle. And that picture will be on the test. The muscles that move the scapula, there's 5 groups of muscles, and each one will do one of those 6 motions we talked about. Elevation, depression, protraction, retraction, or one of the upward or downward rotations. If a muscle is protracting, it has to be anterior. So we'll start with those. And then all the ones on the back, which the majority of them will be helping either with retraction, and then elevation and depression are part of that as well. So the first muscle we'll name is pectoralis minor. It grabs a hold of that coracoid right here and reaches down underneath the pectoralis major, which we'll cover in the second half of the lecture, that pulls our shoulder forward, and that is a protractor of the scapula. So pec minor pulls the scapula forward, and in doing so it also brings it into a rotation. It is helped and opposed by serratus anterior, which is under the arm. It's that scallop looking muscle you see on a bodybuilder, and that pulls your arm forward into protraction, but also elevation, or up, I shouldn't say elevation, upward rotation. We call that one the boxer's muscles. It pulls you like this. So the 2 protractors are both in the front. We have pec minor, which does downward rotation with protraction, and serratus anterior, which does upward rotation with protraction. The majority of the back is covered by a kite-shaped muscle called the trapezoid. Trapezius is its name, shaped like a trapezoid. So the trapezius has 3 portions: an upper, a middle, and a lower. The upper portion elevates, and that's all this muscle here. The middle portion retracts, and the lower portion depresses. Underneath him, or deep to him, is a guy called levator scapula. Levator scapula, believe it or not, elevates the scapula. And then finally, between the 2 medial borders of the to scapula, we have the rhomboids, which will retract the scapula together. So those are all of the shoulder girdle muscles.